In this video, we will discuss how to differentiate a giant lung bulla and tension pneumothorax by chest X-ray. I will show you two different chest X-rays. Try to find which one is giant lung bulla and which is pneumothorax. Chest X-ray A is tension pneumothorax and chest X-ray B is giant lung bulla. How to differentiate them? As both these conditions have hyperlucent areas in the chest X-ray. If you carefully observe in tension pneumothorax, the visceral pleural line of the collapsed lung is seen, and the lung is separated from the chest wall from all of its side. In case of giant bulla, it may be confined to the upper or the lower lobe, occupying more than 1/3 of the hemithorax, and it will compress the remaining normal lung as seen in this chest X-ray. And some part of the lung is usually in contact with the chest wall. But there is a word of caution. In loculated pneumothorax also, the part of the lung is in contact with the chest wall, so it can confuse with a giant bulla. And sometimes the bulla is so giant that the lung tissue is completely replaced by the bulla, and it is called vanishing lung syndrome. If in doubt, always do a chest CT scan, as it is the gold standard to differentiate between giant bulla and pneumothorax. Why it is important to differentiate between these two conditions? The reason is the treatment of both of these conditions are totally different. The treatment of tension pneumothorax is intercostal tube drainage. If intercostal tube drainage is done for a giant bulla, it will lead to continuous air leak, and it may cause more harm to the patient. Why there is continuous air leak? Because in bulla, there are bronchial communications. By these communications, the inspired air enter into the bulla, and then it enters into the intercostal tube, and then it escapes into the atmosphere. And moreover, the lung won't expand in this case. So if in doubt, always do a chest CT to differentiate between these two conditions. Hope this video was useful. See you soon in the next video.